Health put out yesterday, and to just talk a little bit about what's going on in negotiations. Catholic Health statement yesterday basically said that as we enter into the fourth week of the strike, the union was showing no sense of urgency in getting our members back to work. And I just want to make sure that not just the title of the press release, but many of the facts that are included in the document itself are just completely false and misleading. We have been at the bargaining table every day, I think, except once since the strike started. We're working weekends, we're working into the evening, and we are there ready, willing, and able to negotiate. We had a good week this week. It was slow because some of the proposals that the hospital gave us early on were not well thought through. One of those proposals was a proposal on a new pharmacy program. So we had to spend a lot of time asking questions, getting information, and making sure that if there was going to be a new pharmacy program, there would be no adverse effects on our members. We spent hours and hours this week waiting for either information, responses, or proposals from Catholic Health, and for them to try in any way, shape, or form that's saying it's the union that's causing this delay, or for the strike to be as long as it is completely irresponsible. We have said from the beginning, day one of this strike, that if Catholic Health had spent 5 minutes listening to us in January or February or March, we would not even be here right now. For them to insinuate that 2 or 3 hours before a strike is supposed to start, that they can come into our room, throw something down on the table, and expect that that would delay or prevent a strike from happening is just ridiculous. And, you know, we continue to be focused on dealing with our members' primary issues, which are staffing. We are working on safe staffing language, not just for our folks that work in nursing departments, but in respiratory therapy and imaging departments, for environmental services and dietary, and our transport, members that work in transport. We are also continuing to work and fight to make sure that when people do go back to work at Mercy and our folks who are at Kenmore and St. Joe's, we want to make sure that they have a fair wage and benefit package. And we're just not there yet. We have promised our members, and our members have asked of us, that we not come back with a package until we know it's what they want and that it's a package they can ratify. That's our charge, and we are not going to bring a subpar package back for our members to vote on. So we will stay there every day for as long as it takes until we get a contract that we believe our members will ratify. Melissa is a respiratory therapist here at Mercy Hospital, and she's going to say a few words as well.
Hi, I'm Melissa Piavage. I'm a respiratory therapist here at Mercy, typically in the ER. I work in nights. I've been here since 2013. Previously, before becoming a therapist, I was an aide, so I see both sides. I see both sides of, the hurt that nursing goes through, and now I'm currently dealing with what's going on in respiratory. This is, I could say this 1,000 times, this is not something new. The staffing issue is not new. We have asked for this to be taken care of many times. It has only gotten worse through the pandemic, and it's not just the insane amount of people who resigned because of how badly CHS has mismanaged everything. This is also because people have died. People have died, not necessarily, because of anything in the hospital, but we were all affected by COVID, and regardless of what we knew was going to happen, we still came here and we took care of our patients. We took care of our community, and that's what I really want to get back to doing. I miss going to work. I know other people do have other jobs. They work per diem other places. Mercy is my primary source of income in work. I miss seeing the people who come in often, because unfortunately that does happen. I think it's absolutely ridiculous that Catholic Health can say that we are dragging our feet. Wages need to be taken care of, because in order to fix our safe staffing issue, we have to have incentives to bring people in. Nobody wants to come and work for the bottom dollar. Right now, we are the lowest paid hospital. It doesn't matter what position you are in, whether you are cleaning or you are transporting or you're a nurse, it doesn't matter. You're being paid lower than every other position in Buffalo. So, of course, you're going to go where the money is, and you're going to go where it's safe, because not only are these staffing issues unsafe for our patients, they are unsafe for us. If something happens, CHS is not back there to back us. They say, well, you did that, and then we're to deal with it on our own. And God forbid one of us loses our license because we were not properly staffed to take care of these issues. Family members are upset when we, if somebody falls or gets hurt in the hospital. Well, when you don't have the staff to cover somebody who needs one-on-one attention, and rather than giving that one-on-one attention, you have to give your attention to 8, 10 other patients, it's ridiculous. As a therapist, just recently before the strike, I had the emergency room, which you can easily see 20 to 40 patients a night, depending on the night. I had the emergency room. I had 8 east. I had 2 east. I had 2 I, and I had 6 south. Those are all of the areas that I had to cover, because we're working with 5 therapists. Okay, that's 5 people to cover an entire hospital. So it really isn't safe. And I really feel like what they're doing right now is trying to divide us within the union, and not only us, but the community. They're trying to put this blame on us and say, listen, guys, you can't get this great health care because they want to sit out here on strike. Nobody wants to be out here. And I can tell you now, the community is 100% biased. You can drive down any street, you can see our signs. I walk in stores after picketing to go get my dinner for my kids, and I got people saying thank you that I've never seen before. They don't have to come up to me and say thank you. They know what we're out here for. They know that we're here for them more than anything. Catholic Health just put out an ad. It's all over Facebook, it's all over the internet. $20,000 recruitment to non-unionized members. Okay, non-unionized. Why can't we just get the slight raises and the staffing ratios that we're asking for? If you are able to pay a brand new worker who decides not to go in the union $20,000, that makes no sense to me. How are you building new hospitals if you don't have the staff to currently properly staff your hospitals or give the people who are working here what they deserve? It makes absolutely no sense whatsoever. And as for the union not working with them, we've had members of our bargaining committee lose family, okay, just recently this last week, and they're still there. They're still there fighting for us. And for you to say that our members aren't working tirelessly to help us and the community and the patients in this community it's crazy. It's disgusting. I think I heard Mark was supposed to be going on like a trip to Italy. I don't know. I feel like maybe Mark should show his face to the people. I've worked here since 2013. I've never spoken to Mark. I have worked days, I've worked nights, I've worked evenings, okay? I've never seen the man a day in my life. If he was here, if he stepped one foot in that hospital and seen what it was like, I guarantee you he would take back that statement that he made way back when the strike first started, that he would send his family here. You would not send your family member here, not in those conditions, and that's what we're here fighting for. This is a very important part of this community, this hospital. So many people rely on this hospital, and you're right, it is disrupting the community, but for a good reason. Absolutely. And the union, the community's there for us. I promise you that. And there is not a division within the union. I can tell you people have not been more close and there for each other than I've seen before. Anytime somebody needs help, a question, they need help with childcare, they need to switch shifts because they don't have childcare, we're all here for each other. We are all working together, and we all want this to end, but we can't just lay down and say, okay guys, let's go back to work, because then nothing changes. Catholic Health has not put out a solid, concrete staffing. They haven't really said this is how we're going to fix it. Their words have been, we promise to work on this. No, we can't say we promise to work on things. We need something that says this is how we're fixing it in writing to know that this is going to be done, or else all of this was for nothing. All of this disruption, all the money Catholic Health has lost, because I know that's what they're worried about, and this is going to continue, and they are going to lose more members, because how do you go back to work for somebody who doesn't appreciate you or value you? How can you look at us from in there and say, we really care about you, but we're going to let you sit out there in the rain because we're not going to give you a decent raise. We're not going to make sure that you and your patients are safe inside. So I think we all hope that the strike ends soon. I can't wait to go back to work, I can tell you that, but it's definitely not only on our end. We're just trying to make sure that we have what we and the community need to go back.
You mentioned your kids. How hard is this strike on you financially?
It's pretty rough. It is. So fortunately, I come from a two-person household, income household. Not everybody has that. But I mean, anybody who you talk to can tell you how difficult this working here, or anywhere as a matter of fact, but specifically working here through the pandemic was terrible. Okay, the kids didn't have school. I worked my 40 hours a week at night, and I went home and I was my kids' teachers. I was a teacher to 5 children under the age of 11. Okay, so this is all like fundamental stuff that they're learning, and I have to teach it on minimal sleep, and I have to be there for my family, but I'm also expected to be here and do my job and care for my patients. And I think that that's really what hurts everybody the most, is we put so much on the line and sacrifice so much, and we haven't seen anything sacrificed for us. No type of, meeting in the middle.
How concerned are you that so many members have resigned?
It's scary. It really is, because we were short-staffed before this happened. I think that they would have, because, healthcare is one of those things where every year people are graduating, going to school for it. So it's not necessarily that there's a shortage in the workplace. There's a shortage here because there's no incentives. So if they put out good incentives and said, listen, this is how we're going to bring people in, I have no doubt in my mind that we would easily be able to replenish staff. And honestly, people would probably come back if they see in concrete that they would be respected and valued.
But does it present a problem for your cause that so many of your members are resigning?
Absolutely, but if we don't work towards this problem to fix this problem, it's only going to get worse. It's not going to get any better. People would still leave whether we were on strike or not. I mean, they have the statistics to show that over not even just the year of the pandemic, over the last 4 years, we have had a constant decline. This is not new.
Name and spell it, please.
Melissa, Melissa, Piavicz, Piechowicz.
One of the things that happened this week, which was incredibly frustrating, is Wednesday, and we were bargaining and realized that a document came out to not just the non-union members and employees in Catholic Health, but to our unionized members as well, telling people why it's bad to be in a union. And it just goes to the point that Melissa and others are making. We're at the bargaining table. We're supposed to be working together. It's supposed to be labor and management trying to fix the problems and get people back in the door. And they're putting out pages of anti-union rhetoric to their non-union employees. That is why people are leaving, and that's why we're still out here, because there is nobody that believes that they are changing their stripes. The fear, the intimidation, the being called down to human resources to be reprimanded every time you turn around. There is no sign that is going to end when we go back into work. And I think that we have members from the bargaining committee that experience this that can talk about that a little bit more. Maureen, you want to?
Hi, I'm Maureen Kryzak. I'm an RN in the emergency room here at Mercy. Management is out of touch with its members. They don't understand the fear and anxiety that we experience every day walking into these conditions. We fear for our patients, we fear for our safety, we fear for our families that we go home to. They don't understand that if it's dirty, we can contact whatever and take home whatever is going on inside the hospital, whether it be, MRSA, C. diff, COVID, anything. They don't come out of their offices. They don't walk the halls with us. They don't walk in the rooms and talk to the patients with us. They don't put gloves on. They sit in their office and they don't. The only time you hear from a management is if they want to reprimand you. And they don't just come and talk to you and say, hey, let's try to correct this. They want to walk you up to HR immediately. It's a revolving door in HR. If you express your concerns, your fears, your frustrations, automatically you are considered insubordinate to the management and you are taken right upstairs. So members fear for their safety that way. They fear that they're going to be taken to HR. They fear that they're going to lose their job for expressing concerns over the unsafe conditions, the unsanitary conditions. It's just a horrible, horrible atmosphere. We are all here because we love our jobs. We are committed to serving the community. We all chose this. We all want to be back inside. We want to walk into a safe environment where there's no fear of working. There's no fear of expressing our concerns if we feel we're in a dangerous situation. And it's not just the working conditions going into a patient's room. It's the fear of our own safety, the fear of being retaliated against because we cannot express our own thoughts, our own concerns, and our own fears. There's no one for us to talk to. They don't have counselors for us to talk to. There's nowhere for us to go other than to other coworkers. If we go to the management, you're a troublemaker. You're boisterous, you're loud. It's an unsafe all around, mind, body, and spirit. We need to solve this. We need to become a better place to work. They have core values. They need to follow those core values. If we have to work underneath those core values, management needs to follow their core values. Courtesy, one of them. Dignity. They have to show us respect as much as we need to show them. Compassion, very big one, very big. But those core values should be held by everybody, everyone that walks through those doors.
You're on the bargaining committee?
I am also on the bargaining committee.
Can you tell us if you're any closer now than you were the night before the strike began?
Well, of course we are. We've made strides. We've made steps. We have closed a lot of the gap.
What's the hang-up?
Staffing, wages, safety, health insurance.
Something you just said, is there anybody on the Catholic health bargaining system who has any background in actual care of patients?
There are. There's some management that worked in radiology. There's management that were nurses. They do.
It's easy to forget once you put that other hat
Yes.
on what it was
Once
like.
they cross that line, their compassion went with them. I don't know.
What has been missing at the bargaining table is upper administration being there. And it wasn't until after the strike started that we finally had the CFO from Catholic Health join negotiations. But I think it is imperative that we have decision makers there. And I'll just give you an example. So we sat there all day Saturday and we couldn't resolve an on-call issue because they couldn't get the director of the cath lab. And we couldn't solve this ridiculous issue related to red shirts because they couldn't get the chief nursing officer on the phone. There was another issue that we talked about, and well, I'm waiting for some information to get back to you so we can answer your questions. That is ridiculous. We have been on strike for 3 weeks. Every administrator should be on call. If there's a question or information or something that we need to get to the bottom of this, then they should be available. But, you know, we sat and waited for hours on some of the most basic things that should have been off the table even before we went on strike.
Can you give us a brief summation of what your problem is with the statement they put out yesterday? I presume that's why we're here, right?
Yeah, the problem that with the statement that they put out yesterday is the insinuation that it is the union's fault that we are still on strike, and that somehow, like I said, the night before the strike started, they came in and put supposedly this wonderful package on the table, and we're not letting it get back to our members. It is not the package they put on the table the night before we went on strike absolutely would not have been ratified. There is no way it would have satisfied the concerns that our members wanted us to address. Proof of that is that we have been working nearly 3 weeks since they dropped that package on the table to try and get these issues further resolved. So we are focused on staffing, the staffing ratios, no wiggle room. We want to know that in all of the departments where we are talking about staffing issues, that people will be safe and that patients will be well cared for. And we want to make sure that our members get a fair, competitive market wage, and those are still huge issues for us.
What have they proposed in terms of staffing issues that still kind of isn't good enough for you guys? What are they?
So we're still apart on the med-surg ratios. The biggest issue, however, is that they don't want to say that they will absolutely adhere to the ratio. They want this wiggle room. And what we're afraid of, and what the committee has lived through, is, well, we won't meet the ratio for an hour. All right, well, we did okay there, so we're not going to meet the ratio for 4 hours. We'll try and get someone in. And the next thing you know, you have slid all the way down the path to the ratios being completely meaningless. And we can't do that. We have promised people that we will bring back staffing language that will give them the nurse patient, the aide patient, the therapist patient numbers that are safe to work under, and that's what we're striving for.
Are there nurses out there looking for work?
I believe that the number they gave, about 50 people, I don't know if it was nurses or just total employees leaving, is accurate. We have people that are so frustrated that they are telling us even after the strike they may never go back to work at Catholic Health. People are so disheartened by what happened leading up to the strike and their unwillingness to come to the table and just figure this out, that they're really questioning if they can ever work for this employer again. And it's unfortunate because, as Maureen said, this is a critical piece of our community, especially the South Buffalo community and the Southern Tier. They have taken care of these patients and their families for generations, and they want to be in there doing this. If Catholic Health set their mind to it, we could have an agreement in principle tomorrow. That's how fast it could happen. We've whittled down the issues. We got a handful of critical open issues. They should get back to the bargaining table. And I don't know where the Board of Trustees is on this or what they've been doing, but shame on them if they are not actively putting pressure on Catholic Health to get this job done, because there is no reason that they can't come to the bargaining table and get it done tomorrow. And then we can start working on getting people back to work.
Right.
Any other questions or anything else? All right, well, thanks for coming out, folks. We really appreciate it. And we'll be in touch, I think, more regularly this week than we may have been the last couple of weeks. So we'll keep you posted. Thank you.
Thank you.
All right, thank you.